So it comes with a carbon fiber attachment. You feed that through. Then you have your the pieces supplied by them. Feed it through the middle, little pinch, and then pull through. That will release the activated cord. You then pull that back, and then you have your tip. So I prefer to pre-bend the tips. Again, feed them through, and then seal. Now to activate the laser, you'll see that this is the auto settings. It's on 1 watt at the moment, and if you press the book icon here, it will tell you all the things that you can use it for. So you can do it for aphthous ulcers. If you do that, it's a non-cutting mode. Frenectomy, you'll want a slightly higher mode as you're cutting away quite dense tissue. I've got crown lengthening, which essentially isn't really crown lengthening because it doesn't remove the bone. You still have to remove the bone yourself. Gingivectomy is in depigmentation. Curettage, which as I said, I'm using it a lot more for now. Implant recovery, it's fantastic because it doesn't mess around with the tissues. You can place your healing abutments on quite easily after that. Troughing, if you need for your impressions. Endo, laser whitening, perio, and so on. So if we go back to our first mode and then we select blaze, the laser will show that the red tip is now activated, but it also will, the whole screen will go red. This is a 12 watt laser, so this is one of the strongest lasers on the market currently with regards to Quicklase. So really you should have your glasses on at this stage, and so should the patient. And then when you want to stop it, you just press the stop button. So when you're lasing, before you start, you want the beam to be a nice uniform beam. So if there's a lot of scatter, it means you haven't cut the front properly. So you want it to be a nice circle basically. And in order to activate the actual laser, we will hold that against anything with carbon in it, press the pedal, and then you'll see some smoke generating. So I always warn the patient that look, you might see some smoke, or you might feel it a little bit warm. Ideally they really shouldn't feel it warm because they should be numb. So you can see that activating now. Now if I wanted to change the settings, press stop. And as I said, these are my most popular ones. So frenectomy, for example, if I press laser, you can see that the setting will automatically change to 2.5 watts. Now this can go up, so you can manually alter that. So if you have particularly dense tissue, you can. But ideally, I would suggest that you keep it onto the pre-existing settings. And that's it. Once you've done that, you press stop. Once it's green, it's no longer active anymore, and you can see the tip is no longer red. If I turn this around for you, the setup is really, really easy. This cord already comes with some instructions, so don't take this cord out. This is for the power supply unit, and this is for your pedal. And obviously you've got your on and off button there. And you can change the password at the front with pre-existing settings. But that's it.